You have lots of choices of therapy providers in Tuscaloosa, but you only have one licensed inpatient rehabilitation hospital. DCH Rehabilitation Pavilion is West Alabama's first and only Medicare-recognized inpatient rehabilitation hospital, operating since 1984. We continue to be the area's only hospital-based rehabilitation facility, with all of the monitoring and diagnostic capabilities, ancillary services, and physician management available in a hospital, while providing the Medicare-recognized level of intense therapy required of an inpatient rehabilitation facility. A rehabilitation physician is available and rounds on a daily basis. Registered nurses trained in rehabilitation are available to provide hands-on care 24 hours a day. Consultations can be made to numerous other hospital-based healthcare services, such as respiratory therapy, pharmacy, dialysis, social work, dietitians, wound care nurses, and neuropsychology. We can also consult with other physician specialists, as your rehabilitation physician thinks is necessary. We provide a true multidisciplinary team approach to care, with the patient and families being the most important team members. Families are encouraged and expected to participate in the rehabilitation process. Education and training are an integral part of the rehab process, which happens throughout the patient's stay. Your therapist and nurses will explain medication, therapeutic techniques, and safe ways to assist your loved one as a routine part of each day. If families cannot be at the hospital on a routine basis for education, scheduled family education sessions may be set up prior to the patient's discharge. A family conference may be held with the rehabilitation team based on individual needs. Making people able again. That's the goal of every professional at the DCH Rehabilitation Pavilion. We're achieving functional outcomes competitive with national averages by combining our resources with a unique approach to caring. As specialists in the field of rehabilitation, we're acutely aware of the impact disabilities and chronic illnesses have on our patients' social, emotional, and occupational lives, as well as on the lives of their families. Ensuring that our patients and their families are active participants in the rehab process means a lasting benefit to the patient, the family, and his or her community. The DCH Rehabilitation Pavilion follows the hospital visiting hours, which are from 6 a.m. until 9:30 p.m. Families are welcome and encouraged to visit during normal visiting hours and attend therapy sessions during the day. If there are any restrictions on visitation, your team will let you know. Families do not typically stay overnight with the patients, but this can be accommodated if needed. It is essential that you bring your own casual and comfortable clothing, as you will be getting up and dressed each day. Whatever clothing you would wear in the home or community is fine, as well as a pair of rubber-soled shoes. We recommend that you bring a sweater or light jacket, even in the summer months. You may want to bring your own sleepwear, as you can wear that if you wish, or we can provide a hospital gown. Don't forget bathroom toiletries such as your toothbrush, toothpaste, comb, razor, and makeup if you wish. If you wear any splints or braces at home, please bring these with you. Other equipment you may need will be provided. You're welcome to bring your own wheelchair or walker if you prefer. Make sure you mark your name clearly on any equipment that you bring with you. A washer and dryer are available for families to wash clothing for patients. A beauty salon is operated within the DCH Rehabilitation Pavilion. Appointments for patients can be made upon request. Information on hours of operation and prices is available at the Rehabilitation Pavilion Nurses Station. The treatment program will include both group and individual treatment, based on our team members' evaluation and recommendations. We also provide a daily stroke education group for patients and families. The DCH Rehabilitation Pavilion keeps up to date with current treatments and technology. Some of the resources available to you are Captain's Log cognitive training software for patients that have had head injuries or strokes, Vital Stem, which is electrical stimulation to muscles used for swallowing, the Light Gate for body weight supported walking assistance, a visual assessment and compensatory training program, a bladder scanner to assist with bladder management, assistive listening devices such as a pocket talker, and a driving evaluation and retraining program. The majority of patient rooms at the DCH Rehabilitation Pavilion are semi-private. A few private rooms are available for medical needs. Private room requests are accommodated as availability allows. An admission coordinator will talk with you and your family while you're still in acute care to answer any questions you may have and to assist in the transfer to the Rehabilitation Pavilion. There are certain criteria for admission to the DCH Rehabilitation Pavilion. They include functional deficits that require intense therapy with a reasonable expectation for improvement, medical stability for transfer out of acute care while still requiring daily physician and nursing care, ability to follow simple commands and tolerate 3 hours of therapy spaced throughout the day, and an established discharge plan or caregiver. Once you get to the DCH Rehabilitation Pavilion, a rehabilitation case manager will be available to you and your family. If you don't qualify for our program, your acute care case manager will discuss other options with you. Your case manager will assist in making your transfer arrangements. You may either have your family drive you over in your own car, or your case manager can arrange a wheelchair van for a small fee that is due at the time of transport. An ambulance can be arranged if it's required for medical reasons. We look forward to your arrival and are anxious to help you become able again.